Hello, my name is Dr Connor McDonald and I'm a Research Fellow at the Northumbria University and I'm working on the Dementia and Employment Tribunals study alongside Dr Lindsay Bankston. And our study is part of the Working with Dementia Network Plus. This is funded by the ESRC, the Alzheimer's Society and the NIHR. The network has been established to support people living with dementia and their family carers to be able to make informed decisions about their work to more inclusive, supportive workplaces and a society that recognises and values their contributions. Our collaborative and transdisciplinary research network brings together those with lived experience of dementia, carers, health and social care work providers, researchers to policymakers and employers to explore and co-develop innovative and impactful solutions to drive meaningful change for individuals affected by dementia and employment. So although I'm commonly associated with older age, dementia can affect people of all ages, and 7.5% of people living with dementia in the UK are under the age of 65. This is out of an adult population of 944,000. Extended working lives means that conditions that more commonly occur in later life, following retirement, could develop whilst the person is still in employment. And legislation and human rights standards require that disabled people are supported in the workplace through reasonable adjustments or accommodations. And an increasing number of family caregivers will be in employment whilst caring for a family member living with dementia. So I want to start by giving a quick overview of the tribunal process. So bringing in a claim to an employment tribunal requires navigating an adversarial, remedy-dependent and document-heavy process, and claimants must start this process within a strict time limit of 3 months minus 1 day, although the Employment Rights Act of 2025 will be extending this time limit to 6 months. And the steps to the employment tribunal process are outlined just in the slide there. So what is our study about? So the general aim of our study is to analyse employment tribunal judgments relating to dementia across the UK, Canada and Australia, and understand how legislation is applied in workplace contexts. This research will provide learning outcomes for employers and claimants in this area and could also offer recommendations for legal reform. So we're doing this by looking at employment tribunal judgments which are freely available online, and by analysing the judgments we hope to understand the current practice and how legislation is applied, the volume and characteristics of workplace claims, demographics of claimants and respondents, and outcomes and trends over time and how effectively the legal system supports employees in practice. So during the search, the tribunal judgments will be sorted into 3 categories. The first category includes those directly involving dementia in the workplace. The second involves an indirect link to dementia, such as family carers. And the third category are judgments which mention dementia in passing, but aren't relevant to the search. And for judgments directly relating to dementia, we looked at the following characteristics. So the year of judgment, the judgment type, the occupation, gender and age of claimants and the outcome, and these were identified by working alongside the lived experience panel of the network. What have we found so far? So databases from the UK, Canada and Australia were searched using following search terms of dementia, or Alzheimer's or mild cognitive impairment, and for today I'll focus on the UK part of the search. So this returned 5,713 judgments, and out of this 1,500 have been analysed and have shown that 22 judgments directly related to people with a dementia diagnosis, and 56 indirectly related to dementia, and out of this 32 involved carers of people living with dementia. So within the 22 judgments, 18 included claimants with a diagnosis of dementia or MCI, and 4 related to respondents living with dementia. For this study, we'll be focusing on claimants. And just over 1% of cases looked at in the UK were brought by a person living with dementia. I wanted to spend a minute looking at the outcomes of the cases that we looked at. So out of the 18, 3 were successful, 7 were partly successful, so this is where at least 1 claim succeeds. 5 were completely dismissed, 1 was struck out, 1 was partially struck out, and 1 proceeded to further judgment. And out of this number, 10 claimants represented themselves, 1 was represented by a family member, in this case his daughter, and 7 were represented by legal counsel. So what are the UK judgments shown us? So far the judgments from the UK show that very few cases have been brought by people working with a dementia diagnosis. They also show that disability discrimination is the primary claim type, brought in 14 out of the 18 cases. And the success rate for judgments relating to dementia, or relating to people working with a dementia diagnosis, is 55%. And this is quite striking. as a recent study looking at age discrimination in the UK workplaces highlighted a 5% success rate, and the 2019 study showed that in England and Wales, less than a fifth of disability discrimination cases reached a preliminary hearing, and at the final stage, or the full hearing, a claimant was almost 3 times more likely to fail than to succeed. The reasons for these outcomes included restrictive judicial decisions, complex legal tests, inequalities between claimants and employers, and the stigma attached to claimants with mental impairments. These factors contributed to barriers to justice for disabled claimants, making it challenging for them to enforce their legal rights. However, the success rate from our research does indicate that current legislation in the UK is capable of positive outcomes for people living with dementia, and over half of the cases that we looked at centred in MCI rather than confirmed or suspected dementia, and this could indicate that cases are being brought during the earlier stages of the condition. So the qualitative analysis is showing that employer passivity in responding to affected employees. This can be seen in employers not asking for clarification regarding resignation. So, for example, in the case of Mr. D. Watts versus Long Eaton, the claimant was diagnosed with early onset dementia and then subsequently Alzheimer's, and he phoned his employer to tell them about this diagnosis. However, the respondent claimed that during this call, the claimant verbally resigned from his position. After the phone call in August, the next communication was a letter received by the claimant on the 31st of October, informing him that his employment had ended with effect from the 30th of September. The tribunal held that the employer should have, at the minimum, written to the claimant asking for clarification regarding his intentions, and should have gone beyond this and explored the possibility of an alternative role within the company. By not taking this step, the tribunal ruled that the employer was in breach of their duty to make reasonable adjustments, and this amounted to disability discrimination. This case illustrates the detrimental impact of employer inaction, as employers' failure to seek clarification or to explore possible alternatives reinforced the assumption that continued employment following a dementia diagnosis isn't possible. Our study also highlighted the legal vulnerability faced by unrepresented claimants. So surprisingly, most cases that we looked at were claimants who represented themselves. This is a significant observation. As I said before, bringing a case involves navigating an adversarial, memory-dependent and document-heavy process, and this highlighted a procedural vulnerability created by cognitive impairment. For example, this can be seen in the case of Mr. Knight versus Catalyst Housing, as he sent his claim forms twice to his trade union instead of the tribunal, and this resulted in his claim being put out of time. A common issue faced by several claimants was the prevalence of dementia-related stigma within the workplace, and there were 3 separate ways that claimants experienced this. The first was that employers viewed dementia symptoms as performance issues rather than well-being concerns. Secondly, some employers made repeated suggestions that employees living with dementia that they should retire due to their diagnosis. And lastly, that claimants who didn't have a diagnosis themselves still experienced discrimination and stigmatised language due to perceived dementia. And this last point could be seen in the case of Mrs. Boyle versus North Norfolk Limited. So the respondent believed that the claimant had dementia and dismissed her solely based on this. However, the claimant didn't have a diagnosis and wasn't displaying any symptoms. And as a result, she completely won her unfair dismissal claim. So our analysis also raised some interesting questions. The first is that why might someone with dementia choose to self-represent? So the data shows a proportion of claimants appear in person. This raises interesting questions around insight and capacity. So at what stage of cognitive decline is someone still able to navigate a tribunal process? And what does it tell us about their understanding of their own situation that they pursued a claim at all? There's also a question of whether self-representation reflects choice or circumstances. So did claimants have access to legal help? Was the cost a factor, or did they simply not know what was available? One of our core findings was also the disclosure paradox. So why do some people disclose a dementia diagnosis to an employer, whilst others don't? And what are the psychological dynamics driving this? Is it fear of stigma? Is it trying to preserve a sense of identity? Is it wanting to maintain a sense of normality at work? Or is it an indication that there's a lack of trust with their employer? There's also questions around the decision-making at the point of bringing a claim. So pursuing a tribunal claim involves a sequence of complex decisions over a sustained period of time. For someone with dementia or MCI, what cognitive demands does this place on them? What support structures appear in the cases? Is it family members, trade unions, advice services, and what happens when these are absent. There's also questions around the gap between legal and clinical timelines. So tribunal claims are often brought sometime after the employment relationship has ended. By the time a case is heard, cognitive decline might have progressed significantly from when the events occurred, and this raises questions around memory, evidence reliability, and how the law handles or fails to handle this. There's also questions around what the legal data doesn't tell us. So the data set shows outcomes in some procedural detail, but it can't tell us about the lived experience of going through the process. The legal data explored in the study could be a good starting point for interdisciplinary work to explore the subjective experiences of claimants with a diagnosis of dementia or MCI. And legal experts within the network would be very happy to join the psychology team if they need that legal angle to any future research projects exploring these issues. So thank you for listening. I've included here my LinkedIn and my email address if you have any further questions. And there's a QR code there that takes you to the impact feedback form for the Working with Dementia Network Plus. Thank you.